I'm going to be performing task number 2, which is PCV/TP, or packed cell volume and total protein. So I have my whole blood sample in this lavender top EDTA tube. There are no clots noted, so I'm just going to gently invert it 4 to 6 times. I count back and forth as 1, so that was about 6 times. So what I'm going to do, I have my 1 cc syringe here with a new needle. I'm just going to poke it through the lid just to get a little bit of a blood sample. And you don't need much because you only want to fill up your hematocrit tubes like 2/3 to 3/4 full. So I'm probably going to take out about 0.2. Okay. Just going to put my sample over here, and then I'm carefully just going to make sure that there's no air bubbles in my syringe so that I don't have any difficulty loading up my tubes. So I got rid of the little air bubble. So then what I'm going to do, I'm just going to gently put the bevel of the needle at the very end of the tube, and I'm slowly going to fill it up about 3/4 of a way. And then that's going to plug off the end with my finger. And then I'm gently going to take a Kim wipe to wipe the end of my tube before I put it in the clay to help seal it. And you need a balance, so I'm just going to fill up one other tube so I can have a balance when I go to centrifuge it. So again, I'm just going to take my sample that has the needle with the bevel end of the tube. I'm just going to fill it up 3/4 of the way. You want to do a slow push because you don't want to damage any cells and you don't want air bubbles. I'm going to clog the end. I'm just going to wipe the end of the tube with a Kim wipe again. And then while holding it so that my blood sample doesn't come out, I'm just going to put it in the sealant clay once again. And you want to make sure that you have a good amount of the clay at the bottom because you don't want your tubes to spin out. Sometimes if you only do 1 or 2 little clays, it won't seal it all the way, and unfortunately sometimes it spins out and you lose your sample. Okay, so I feel confident I have enough clay at the bottom. So those are my 2 PCV tubes, okay? And then my clay at the bottom, nice and full, so that hopefully we don't spin out. So what I'm going to do, first I'm going to take my sharps and put it in my sharps container over here. And then what I'm going to do, this silver cover comes off, and this is my micro hematocrit centrifuge, so spins down the PCV tubes. So when you place it in, you want to record what slot number you put it in just so that you don't mix up any samples. Luckily this is the only one getting spun down right now, so I shouldn't have any complications with mix-ups of my samples. So when you place it down, you want to make sure that the clay is on the outside portion, because when it goes around and centrifuges, the samples are going to go down, and if you have the open end over here, your sample's going to spin out. So if you have the clay on the outside, it should stay in. So I'm just going to place it with the clay on the outside, and then I'm going to place it directly across to level it out. And then I have a pen and a sticky note right here that I'm just going to write down my slot numbers. So my patient's name, and then it's slot number 15 and slot number 3. Okay, so I'll put that on top once my sample's done. Spinning, or once I finish covering it, I'll put it up there to label my sample. So I'm just going to take the lid and I'm going to go down as much as I can to secure it so that my samples don't fly about and break. And then the major lid is going to close down and close. So everything is all set. So now what I'm going to do is just I'm going to take my timer down here and we put it up to 3, because that's going to be for 3 minutes. So I'm just going to be waiting for 3 minutes as my sample spins down, and then we can read my sample. Move my Kim wipes over here so it's not in the way. And then I'm just going to move the camera down a little bit so that you can see the counter as I'm finishing up the rest. Try not to block it too much. Just gonna zoom in just a little bit. Perhaps down a little bit more. There we go. So again, I'm just waiting for my sample to finish spinning. Well, in the meantime, I'll go over all the other supplies that I need to do. So once it's done spinning, we're going to use our micro hematocrit capillary tube reader. And then we also have our refractometer to get our total protein. And we also just have one slide because in order to get your plasma out for the total protein, you need to use this to score the tube a little bit before you break it. So we got about a minute left for spinning. I guess I shouldn't have gone all the way down yet because you can't see my face. And again, I have it in slot 15 and slot 3. This way it is balanced out and should be not spinning out. Should have my sample totally fine. And then again, you want to start with your card because you're going to line the bottom of your red cells up with the 0%, and then the top of the plasma is going to get aligned with the 100%. And your reading is going to be the top of the red blood cells. Zoom out a little bit. You know, PCV gives us a lot of information in a little bit of blood. It can tell us if a patient is dehydrated. It can tell us if a patient is anemic. So it's very helpful, you know, when you have like stat triages coming in and you need to know some results right away. We generally do a PCV with a lot of our, you know, stat triages just to see where the red blood cell level is at, if they're dehydrated, if they're hydrated. So the 3 levels is you're going to have your top, which is going to be the plasma, the middle white part is going to be your buffy coat, and then the bottom part is going to be your red blood cells. And it looks like we're just about done. Alright, so it is done, and then we're just going to wait for it to finish spinning. And you want to wait for it to completely stop on its own because you don't want to interfere with stopping it because then you might actually cause a little damage. So while that's doing that, I'm going to go back down to the counter. And then we will read it once it comes out. Just about done. Alright, so we're going to raise up the upper lid. And we are done. We're going to unscrew this. Alright, and again, my patient sample is slot 15 and 3. So this is 15 and 3. Okay, so I can throw that out. And as you can see, they both spun down nicely. So this top part is going to be your plasma. This little white part is going to be your buffy coat. We do not include that in the PCV. And then you have your red blood cells down here and then the clay. So then what I'm going to do, I'm just going to zoom in just a little bit. Okay. So again, the way I'm going to use my card reader to get my actual PCV is going to be lining up, going to be using my card. I'm going to put the bottom of the red blood cells on the 0% line, and then you want to scroll over for when your plasma is at the 100% line. So 0%, 100%, and then so it's looking like, and then you want to go to the top of where your red blood cell is. So for this, it's looking like it is 45, 46, 47. And then it's always nice to have at least 2 PCV tubes because you can compare if you get the same number, if you get a different number. So then again, the top of the clay, the bottom of the red blood cells goes on 0. And then the top of the plasma goes to 100%. And again, I am getting about 47, 45, 46, 47. So then that's going to be recorded as a percent. Zoom out a little bit. That's going to be recorded as a percent. So again, I got my pen and my paper for my patient. I'm going to write PCV equals 47%. And then in order to get your total protein, we have our refractometer, which has a little cover slip that you lift up. We'll place that right there. And then this is where you just want to take a glass slide, and you're going to use the corner of it just to score above where the bottom, the top of the buffy coat and the bottom of the plasma. You just want to score it just a little bit so that it's easier to crack. Okay, and then you're going to take your 2 fingertips and apply pressure to both sides to get a nice easy snap. And then I'm just going to hit my hand on the counter with the other side so there's no glass shards, just to get a drop onto the cover. Okay, so you see my single drop right there. Then you take the cover slip lid and put it over. And then in order to get your reading, you're going to look through the eyepiece and you point it up towards the light, and you want to see where the white or the lighter color meets the darker color, which looks like a bluish, and it makes a line. So that line is going to be your total protein. So it's looking like we are at 7.0, and that's measured in grams per deciliter. So down here, I'm going to say 7.0 G per DL, which is grams per deciliter. And then if you give me one moment, I'm just going to go see if one of my mentors is available just to double check me.